All right, get ready, because today we're going deep into the world of chronic neurological disorders.
Ooh, sounds intense.
It is, but fascinating too. And to guide us, we've got Dr. Birru's amazing lecture notes.
Ah, Dr. Birru, a legend in the field.
Absolutely. His work is groundbreaking, and these notes, they're like a treasure trove of knowledge.
I can imagine he's always pushing the boundaries of what we know about the brain and nervous system.
Exactly. So think of this deep dive as your crash course in neurology.
Led by Dr. Birru himself, even though he's not physically here.
Right. We're talking about everything from brain tumors and epilepsy to Parkinson's disease and even stroke.
Wow, that's a huge range. Over 600 conditions, if I remember correctly.
You got it. But today, we're honing in on the chronic degenerative ones.
The ones that really challenge our understanding and treatment approaches.
Precisely. And speaking of challenging, Dr. Birru dives right into multiple sclerosis, or MS, in his notes.
Ah, MS. A real mystery wrapped in an enigma.
It really is. He describes it as an autoimmune disease where the body attacks its own central nervous system.
It's like the body's defense system has gone rogue, turning against itself.
Right. And it specifically targets the myelin sheath.
The protective coating around nerve fibers, right?
You know it. It's like stripping the insulation off electrical wires. Signals get all messed up.
And the consequences can be pretty severe.
They can. Dr. Birru mentions a wide range of symptoms. Weakness, vision problems, tingling, even electric shock sensations down the spine.
He calls that Lhermitte's sign. Right?
Yeah, Lhermitte's sign. Sounds pretty intense. It's crazy how the loss of myelin can cause such a wide array of effects.
It is, and it makes diagnosis and treatment really tricky.
Absolutely. There's no cure for MS, sadly. But Dr. Birru emphasizes managing symptoms, slowing progression, and improving quality of life.
So focusing on making life as good as possible for those living with MS.
Exactly. He talks about medications to reduce inflammation and therapies to address specific symptoms.
It's like a multi-pronged approach, tackling the disease from all angles.
It is. And while a cure might not be here yet, the research is ongoing, and there's a lot we can do to help people with MS.
That's reassuring to hear. Now, Dr. Birru also covers another autoimmune disorder, myasthenia gravis, or MG.
Ah, yes, MG. This time, the immune system attacks the communication between nerves and muscles.
So instead of targeting the myelin, it disrupts the actual signals.
You got it. Imagine trying to tell your arm to move, but the message gets lost along the way.
That's going to be frustrating.
Incredibly so. Dr. Birru describes symptoms like drooping eyelids and difficulty swallowing.
And the weakness fluctuates, getting worse with activity.
Exactly, like your body just gives up on you at random.
And just like MS, the exact cause of MG is still a puzzle.
But Dr. Birru points to the thymus gland as a potential culprit.
The thymus gland, isn't that part of the immune system?
It is. It might be giving faulty instructions, leading to this attack on nerve-muscle communication.
Wow, so a tiny gland could be causing all this trouble.
It seems that way. But there are treatments available, like medications and even surgery, to remove the thymus in some cases.
So taking out the troublemaker can actually help.
Sometimes, yes. It's fascinating how Dr. Birru explains these intricate processes.
He has a real knack for making complex stuff understandable.
Okay, so we explored 2 autoimmune disorders. But Dr. Birru doesn't stop there. He goes on to discuss Huntington's disease, or HD.
HD, a genetic disorder with a truly heartbreaking trajectory.
It is. Dr. Birru mentions a 50-50 chance of inheriting it if one parent has the gene.
And the symptoms? They're devastating. Movement problems, cognitive decline, even psychiatric issues.
It's like a full-blown assault on the brain and body.
And it all stems from an imbalance of dopamine, that neurotransmitter crucial for movement, mood, and reward.
Right, dopamine. The brain's happy dance chemical, some might say.
Exactly. But in HD, an imbalance leads to chorea, those jerky movements.
So it's more than just a movement disorder. It affects a person's whole being.
It does, and unfortunately, Dr. Birru notes that death typically occurs 10 to 20 years after symptoms start.
That's incredibly sad. So what does care look like for someone with HD?
Dr. Birru stresses palliative care, providing comfort, managing symptoms, supporting both the patient and their family.
It's about making the most of the time they have left.
Exactly. And medications can help with some symptoms, but ultimately, it's about quality of life.
This really highlights the importance of early diagnosis and intervention.
Absolutely. Now let's switch gears a bit and talk about Guillain-Barré syndrome, or GBS.
GBS, often triggered by an infection, believe it or not.
Wait, really? How does that work?
The immune system, while fighting off the infection, mistakenly attacks the peripheral nervous system.
So it's like friendly fire, but with devastating consequences.
Sadly, yes. Dr. Birru describes rapid onset, ascending paralysis as a hallmark of GBS.
Ascending paralysis, that sounds terrifying.
It is. It starts with tingling in the legs, but it can progress to full-body paralysis within days.
Wow, that's scary fast. Is there any hope for recovery?
There is. Dr. Birru emphasizes that most people recover fully from GBS, though it could take months or even years.
That's a long road, but at least there's hope.
Right, and treatment focuses on supporting breathing, managing symptoms, and speeding up recovery with therapies.
It's amazing how the body can bounce back from such a severe attack.
It really is. Dr. Birru's knowledge of these conditions and their nuances is incredibly impressive.
He's a true master of neurology, and we've only just scratched the surface of his insights.
That's right. There's so much more to explore, and we'll dive deeper into Dr. Birru's world in our next segment.
I'm ready when you are. Let's continue this fascinating journey.
Sounds good to me. Stay tuned, everyone.
All right, so moving on from GBS, Dr. Birru next tackles Parkinson's disease, or PD.
Yeah, PD. I think most people, when they hear Parkinson's, they immediately picture those tremors.
Right, the shaking. But as Dr. Birru points out, there's so much more to it than just that.
It's not just shaky hands. It's a much deeper problem. He talks about the progressive loss of those brain cells that produce dopamine.
Ah, dopamine. Crucial stuff. So what happens when those cells start dying off? What does that actually look like for someone with PD?
Well, Dr. Birru explains it like this. Dopamine is kind of like the brain's smooth operator, right? It helps initiate and coordinate movement.
So when those dopamine-producing cells die off, the signals get all jumbled up.
Exactly. And that's where those motor symptoms come in. It's not just the tremors.
Right, you mentioned the classic triad of Parkinson's symptoms?
Yeah, he lays it all out. Tremor, rigidity, and then there's this thing called bradykinesia.
Bradykinesia, huh? Sounds like a mouthful.
It is. But basically, it just means slowness of movement. Imagine trying to button your shirt, but your fingers are just moving in slow motion.
Or walking across a room, but it feels like you're wading through molasses.
Ugh, that sounds frustrating.
Incredibly. And it's not just the physical stuff either. Dr. Birru highlights those non-motor symptoms too.
Oh, right. Like what kinds of things?
Well, he mentions sleep disturbances, depression, even cognitive changes. It's like Parkinson's attacks on multiple fronts.
So it really impacts a person's whole life, not just their physical abilities.
Absolutely. It's a real challenge to live with.
It makes you appreciate just how delicate the balance is in our brains.
It does. But reading through Dr. Birru's notes, I'm struck by his optimism.
Oh, yeah. How so?
Well, he emphasizes that even though there's no cure for Parkinson's yet, there are ways to help people live well with it.
So it's not just a doom and gloom diagnosis, there's hope.
Exactly. Dr. Birru is a big advocate for a multi-pronged approach to treatment.
Like what kinds of things?
Well, he talks about medications like levodopa, which can actually help replenish dopamine in the brain.
So that's like directly addressing the root of the problem, in a way.
It is. And then there are things like deep brain stimulation, physical therapy, even speech therapy.
So it's really about finding what works best for each individual person.
Right. Tailoring the treatment to meet their specific needs.
It's inspiring to see how Dr. Birru approaches these challenges with both scientific knowledge and real compassion for patients.
He really gets it. He understands what people are going through.
Okay, so we've covered Parkinson's, but Dr. Birru doesn't stop there.
Nope. He dives into another condition, one he describes as particularly devastating.
Oh, which one is that?
Amyotrophic lateral sclerosis, or ALS, also known as Lou Gehrig's disease.
ALS. I remember
Oops.
reading about that. It's a progressive disease that attacks motor neurons, those nerve cells that control our muscles.
Right. And as those motor neurons die, the muscles they control start to weaken and waste away.
Eventually leading to paralysis, right?
Yeah. Dr. Birru lays out the harsh reality. Most people with ALS don't live more than 5 years after diagnosis.
5 years. That's not a lot of time.
It's not. And what makes it even more tragic is that the person's mind stays completely intact.
So they're fully aware of what's happening to their body as they lose control.
Exactly. It must be incredibly difficult, both for the person with ALS and their loved ones.
It's like their mind is trapped inside a failing body.
It's heartbreaking. So what can be done? Is there any way to help?
Well, Dr. Birru really stresses supportive care as being paramount here.
Meaning?
Managing symptoms, making sure they're comfortable, providing respiratory support as their breathing gets affected.
It's more about quality of life than finding a cure at this point.
Sadly, yes. But it's still so important to provide that care and support.
Absolutely. Dr. Birru's compassion really shines through in his...
This one's a bit of a mystery, actually. He saves it for last, almost like a hidden gem.
Ooh, I'm intrigued. Tell me more.
All right, lay it on me. What's this mystery condition Dr. Birru's got tucked away in his notes?
Well, it's called normal pressure hydrocephalus, or NPH for short.
NPH, huh? I haven't heard of that one.
It's not as well known as some of the others we've talked about, but it's just as important according to Dr. Birru.
So what's the deal with NPH? What causes it?
It's a brain disorder where you get this buildup of cerebrospinal fluid, the fluid that cushions the brain and spinal cord.
The brain is basically getting waterlogged.
Pretty much. And as that fluid builds up, it starts putting pressure on the brain, which can cause some problems.
Okay, that makes sense. What kinds of problems are we talking about?
Well, Dr. Birru highlights three main symptoms: difficulty walking, cognitive impairment, and then urinary incontinence.
Whoa, that's quite a mix. You wouldn't think those things were all connected.
That's the thing with NPH. It can be really tricky to diagnose.
Why is that?
Because those symptoms, they can overlap with other conditions like Alzheimer's or Parkinson's.
Ah, so it's kind of like a neurological chameleon mimicking other disorders.
Exactly. But here's the thing. Unlike Alzheimer's or Parkinson's, NPH can often be treated effectively with surgery.
Wait, hold on. Surgery for a brain disorder. That sounds kind of intense.
It is brain surgery, but Dr. Birru explains that it's a fairly straightforward procedure called a shunt placement.
A shunt. What's that?
Think of it like a little tube that gets inserted into the brain. It helps drain that excess fluid and redirect it to another part of the body where it can be absorbed.
So it's like a plumbing bypass for the brain.
That's a great way to put it. And get this, the results can be pretty amazing. Dr. Birru describes cases where people who could barely walk or remember things after the surgery, they're practically back to normal.
Wow, that's incredible. It's almost like hitting the reset button on the brain.
It really is. It makes you wonder how many people out there might have NPH and not even know it.
That's a good point. It seems like early diagnosis is key here.
Absolutely. Dr. Birru really hammers that home in his notes. The sooner NPH is treated, the better the chances of a good outcome.
It's like with so many of these conditions, awareness is crucial.
Knowledge is power, right?
Couldn't agree more. Well, we've covered a lot of ground today, all thanks to Dr. Birru and his incredible lecture notes.
We've gone from autoimmune disorders to genetic disorders and even explored this lesser-known condition, NPH.
It's been a wild ride, but incredibly informative. Dr. Birru has such a gift for explaining these complex topics in a way that makes sense.
He really does. And he doesn't just present the facts. He brings a real sense of compassion and hope to the discussion.
Absolutely. It's clear that he's dedicated his life to understanding these conditions and finding ways to help people who are affected by them.
His passion for neurology is contagious. It's inspiring to see someone so committed to advancing knowledge and advocating for patients.
Well said. I think that's a perfect note to end on. For our listeners out there, if you're feeling inspired to learn more about the brain and nervous system, I encourage you to keep exploring.
There's a whole world of fascinating discoveries out there waiting to be made.
And who knows, maybe you'll be the next Dr. Birru, making groundbreaking contributions to the field of neurology.
That's a great thought.
Thanks for joining us on this deep dive into the world of chronic neurological disorders. Until next time, keep those brains buzzing.